Hi everyone, we're back, and today we're going to talk about the new nurse and the stroke patient. Here is Jenna, a new nurse, has never taken care of a stroke patient before. She's thinking, I have no idea how to do a stroke assessment. The patient she's thinking about is Anne, an opera singer, who on stage was having problems getting her words out, also experiencing problems with coordination. Anne was having stroke symptoms. Naturally, she's brought to the emergency room and into the ICU so that she can have a workup. Now, let's talk about abnormal posturing. Patients who have strokes can have abnormal posturing. They may even have what is called decerebrate posturing, where there is abnormal extension of the arms and legs, the head is flexed backwards, or they might have what is called decorticate posturing, and as you can see, the arms are flexed onto the chest, left flexed and turned inward. In fact, it is said of these patients the posture resembles that of an ancient mummy. If you'd like to learn more about how to assess a stroke patient, please go to dearnurses.com for a complete stroke assessment, and it's called the Stroke Series Assessment in the Clinical Setting. Now, the brain-injured patient having abnormal posturing in the Glasgow Coma Scale on Neurological Assessment tool is more than likely to be flexion 3, extension 2. And the part of the Glasgow Coma Scale that you would work on would be called motor response. Never do you get no response being 0. 1 is as low as you can go. Now, last but not least, we're going to talk about where you can find a number of interesting topics related to the stroke patient, and that is if you go to dearnurses.net, and it's called What Is It? A collection of helpful clinical information for nurses. Chapter 6 will enlighten you on a lot of your questions again about the stroke patients. In fact, the information that I've just provided you has come out of that one. So I hope you have benefited from what we have discussed today. There's tons of information that you can learn. There's plenty more that you can learn. So chapter 6, dearnurses.net, what is it? Clinical information, a helpful collection of clinical information for the stroke patient.